When most people think about fertility, they think about hormones, estrogen, progesterone, ovulation. But there's something much more basic that almost never gets talked about, and that's blood flow. And here's the thing. You can have normal hormones on paper, but if those hormonal signals aren't being delivered properly, well then your system can struggle to function and it will still be hard to achieve pregnancy. Hi, I'm Batya. I'm a Chinese medicine practitioner, a midwife, and a fertility specialist. And I work with women who are trying to conceive, but feel stuck or unsure about what actually matters. Whether everything looks normal, or there's a diagnosis, but the path forward still remains unclear. In this episode, I want you to understand 3 things. What blood flow actually means in the context of fertility, how it influences both egg development and quality, and uterine lining and implantation, and why it's often the missing piece when it comes to fertility, even when everything else looks normal. Because hormones don't act in isolation. They have to be delivered. They have to reach the ovaries. They have to reach the uterus. They have to reach the uterine lining. And all of this happens through circulation. Blood flow is how your body delivers everything: oxygen, nutrients, hormonal signals, and immune signals to all of the tissues that are responsible for reproduction. So when we talk about fertility, we're not just talking about what your body can produce, but we're also talking about what your body can deliver. So I want you to understand 3 important aspects about circulation and blood flow. The first thing you need to understand is this: fertility isn't about production, it's about delivery. So you can produce hormones and you can produce eggs. But if the body's signals, if the hormones aren't being delivered consistently to the tissues that need them, well, then the system doesn't function as smoothly as it could. And that's why normal labs don't always translate into pregnancy. The second aspect that you need to understand is nourishment. And this connects directly to what we talked about in the last episode about egg quality. An egg doesn't develop in isolation. It develops in an environment that depends on circulation. It receives nourishment via the blood flow, so that the egg quality is directly impacted by the body's ability to deliver hormones and nutrients via the blood flow to the egg. And that's the same thing is true for the uterine lining. The lining isn't just there. It's built, it's nourished, and it's maintained through consistent blood flow. And that influences how it develops, how receptive the lining is, and then how stable it is for implantation and then a subsequent pregnancy. And the final piece I want you to understand about circulation and blood flow is that it's not just mechanical, right? Blood flow can be impacted by mechanical obstructions like scars in the lower abdomen or issues with the pelvis, but blood flow can also reflect the state of the whole system, because there are many aspects of your system that can impact your body's ability to flow, for the blood to flow smoothly. Stress physiology can cause constriction in the circulation. Inflammation can alter vascular function. Low movement can reduce blood flow. And nutritional status can also affect circulation. So when circulation is suboptimal, it's often not just a local issue, although it could be, but it's often a reflection of broader physiological patterns. So in the clinic, we can look for patterns that will show us, that reflect how your circulation is functioning in your body. Symptoms like painful periods, clotting in the menses, feeling cold, a thin uterine lining, cycles that feel sluggish or inconsistent. Well, all of these aren't random. They're often reflections of how your blood is moving, or maybe not moving, through your system. So again, we come back to the same idea. Fertility isn't about one thing. It's about how all of your systems interact. You can be ovulating, your hormones can be in range, but if the delivery of those hormonal signals and of other nutrients is inconsistent, well, your system may still hesitate. It's not just what is your body producing, but it's what is your body consistently able to deliver. Now, if you're thinking, wait a second, I might have circulation issues. What should I do? Well, I want you to know there are definitely ways to support and improve circulation. But what matters most right now is understanding why your circulation might be impaired in your specific case, because then you can know exactly which levers to implement instead of just trying everything. It's true that things like movement, warmth, and reducing inflammation can all play a role in improving circulation. But the real question right now is, what's driving circulation issues in your system? If you want a grounded place to begin supporting the systems in your body that influence all of this, right? Your circulation, your metabolism, inflammation, and nervous system regulation, I created a guide called The 5 Fertility Secrets Your Body Wants You to Know, and it's linked below. In the next episode, we're going to talk about something many women rely on heavily in the fertility process, and those are supplements, and why even when supplements are well chosen, they don't always create the shift that you're hoping for. For now, I want to leave you with this. Your body isn't broken, your symptoms aren't random, and fertility doesn't respond to pressure, it responds to support. Take this as an invitation to listen more gently and more purposefully. Your body is wiser than you think.